Hello, and welcome to Interior Health's Adult Type 2 Diabetes video series. My name is Jackie, and I am a registered dietitian and diabetes educator. This video is about alcohol and diabetes.
Just a few reminders as you watch this video series. We encourage you to watch the videos in order. And just remember, you can go back and watch the videos as often as you'd like. Fraser Health on the Road to Diabetes Health is a great resource to accompany this video series. And remember, you can pause the video at any time if you would like to spend a little bit more time reviewing the information. We would like to acknowledge that our work occurs on the beautiful, traditional, ancestral, and unceded territories of the First Nations of the interior region. We also recognize the Métis Nation and the contributions of the Métis peoples to the Indigenous ways of being and knowing on this land.
What we're going to cover today is when you should not drink alcohol, some questions to ask to decide if you should include alcohol, what does moderate drinking mean, and what are some important risks that you need to be aware of when drinking alcohol? You may have heard that alcohol has certain health benefits. However, any pattern of drinking can be harmful. Proven ways of improving your health include healthy eating, being active, and being a non-smoker. As a general rule, there is no need to avoid alcohol because you have diabetes. However, there are some more important things to consider. You should not drink alcohol if you are pregnant or trying to get pregnant, if you are breastfeeding, if you have a personal or family history of drinking problems, if you're planning to drive or engage in other activities that require attention or skill, if you are taking certain medications. You can ask your pharmacist about your medications if you're wondering. Some questions for you to consider. Is my diabetes under control? Am I free from health problems that alcohol can make worse, such as disease of the pancreas, eye disease, high blood pressure, high triglycerides, liver problems, nerve damage, or stroke? Do I know how to prevent and treat a low blood sugar? This information was covered in the video called Highs and Lows of Blood Sugars. If you answered no to any of these questions, you should speak to your diabetes educator or healthcare professional before drinking alcohol. If you answered yes to all of these questions, it is okay to drink alcohol in moderation. Moderate alcohol intake is limited to 2 standard drinks per day or less than 10 drinks per week for women, and limited to 3 standard drinks per day or less than 15 drinks per week for men. This recommendation is the same for people without diabetes. For people with high blood pressure, alcohol should be limited to 1 drink per day for women and 2 drinks per day for men. It is important that you know that alcohol can have some risks for people with diabetes. It can affect your judgment. It can provide empty calories that might lead to weight gain if taken in excess. It may increase blood pressure and triglycerides. It may cause damage to your liver and nerves, including your brain and sexual organs. It can contribute to inflammation of the pancreas. It can dehydrate the body, which is very dangerous in someone with a high blood sugar, and it could worsen eye disease. If you take insulin or some specific pills for diabetes, drinking alcohol can also increase your risk of having a low blood sugar. To reduce this risk, take the following steps. Before drinking alcohol, you should eat regular meals, take your medications, and check your blood sugar levels frequently. So you may want to keep your blood glucose meter with you at all times. Always have a treatment for low blood sugar with you. Please see the video called Highs and Lows of Blood Sugars for more information on this. Wherever you are, make sure someone with you knows your signs and symptoms of low blood sugar and how to treat it so they can help you. Please wear diabetes identification, such as a medical alert bracelet. Talk to your pharmacist or family doctor if you have questions. Thank you for watching this video about alcohol and diabetes. We encourage you to view the remaining videos for more information about living well with type 2 diabetes.